Urge incontinence is a completely different disease, really related to an overactive bladder, which we're now starting to learn the pathophysiology of that. Okay, it could be a vascular phenomenon, ischemia, or lack of blood supply to the bladder due to atherosclerosis. Could it be because you have, irritants in the bladder, stones or tumors and whatnot, and people just have a contraction that they cannot suppress? It's very important for those folks to look for help, because really you have to rule out other significant urological pathologies before you just label them as incontinent. There are, like I said, inflammatory conditions or tumors or such infections that can render people incontinent. So it's not necessarily a phenomenon of aging, but it could be a symptom of something else, number one. Number two, if nothing else is found, it's a totally treatable condition. It's easy to treat, not always, but is very treatable. And if you think about it, how much that interferes with your quality of life. In terms of, we have patients, for instance, that work in cubicles and they have incontinence and they don't say anything to anybody, but people cannot, relate to them. People try to move away from them because they smell like urine, for instance. People that have no social life, they go to parties, but they have to be very aware of where the restrooms are because they're afraid that all of a sudden they're going to get an involuntary contraction and they're not going to make it to the bathroom. We have ladies that get up at night 4 or 5 times, and sometimes they will slip and break their hips, and that sometimes will lead to pneumonia, hospitalization, and even death. So I think it's a very important health issue as well, and people really should look for help when they become incontinent.